Hello viewers, good day to all of you. So today I am going to discuss about the posterior compartment of the leg, which is also called as the flexor compartment. Now the learning objectives for today will be with respect to the posterior compartment will be the superficial structures which is present on the posterior aspect of the leg, then the deep fascia, how the deep fascia is disposed around the leg, then the muscles which is present in this compartment, then we are going to see about it is the muscles only which is called as the Triceps Surae, mainly the two muscles they combine to form the Triceps Surae, then vessels and nerves of the posterior compartment, and finally some applied aspects. The superficial structures, immediately what comes to our mind is the skin, and deep to the skin what we have is the superficial fascia. So in the superficial fascia mainly we come across the superficial cutaneous nerves, the nerves which supplies the skin, then any cutaneous blood vessels, especially the superficial veins, and then the lymphatics. So one important superficial vein which you come across in the posterior aspect of the leg is the small saphenous vein. Then variable amount of fat is actually present. With respect to the small saphenous vein, we will be discussing it separately in the venous drainage of the lower limb. Lymphatics, I have already discussed about it. So from the posterior aspect, the lymphatics will follow the course of the small saphenous vein, and it will go and drain into the popliteal lymph nodes. Okay, deep lymph nodes, which is the popliteal lymph nodes. Posterior aspect of your heel region, calf region is all will be draining into the popliteal lymph nodes. So here you are able to see the cutaneous innervation, mainly the termination of the posterior femoral cutaneous nerve or the posterior cutaneous nerve of thigh. It pierces the deep fascia and it is present near to the termination of the small saphenous vein. So it is going to supply the skin over the deep fascia and upper part of the posterior compartment of the leg. The skin of the upper part of the posterior compartment, back of the leg. Then the next nerve you see is the sural nerve. The sural nerve combines with the sural communicating nerve. Okay. It combines with the sural communicating nerve and supplies the skin of the lower part of the calf. It's a branch of tibial nerve. Sural nerve is a branch of tibial nerve, and sural communicating nerve is a branch of common peroneal nerve. Then the next nerve, cutaneous innervation, will be the lateral cutaneous nerve of calf. This is again a branch of the common peroneal nerve which supplies the upper lateral part of the back of the leg. Okay. So lower part is mainly supplied by the sural nerve and sural communicating nerve, and the lateral cutaneous nerve of the calf supplies the upper lateral part of the calf. Saphenous nerve mainly supplies your medial side of your calf and the leg region, medial border of the foot. Then the heel region is mainly supplied by calcaneal branch of the tibial nerve. So posterior surface of calcaneum and heel region is mainly supplied by the calcaneal branch of the tibial nerve. So these are the branches: posterior femoral cutaneous nerve, sural and sural communicating nerve, saphenous nerve, lateral cutaneous nerve of calf, and the calcaneal branch of the tibial nerve. Now coming to the disposition of the deep fascia, the fascia, the deep fascia of the leg is actually called as the fascia cruris or cruris. So it surrounds the whole of the leg and encloses all the three compartments. Your extensor compartment, a small lateral compartment or the peroneal compartment, and then you see the large and massive posterior or the flexor compartment. So like a tight sleeve, same like your deep fascia of the thigh. So in front it is attached to the anterior border of the tibia, and behind to the medial border it gains attachment along the medial border up to the medial malleolus. Okay, and inferiorly it will blend with the retinacula of the foot. Laterally it is attached to the anterior and posterior margins of the fibula through the intermuscular septum. Okay, so it also gives intermuscular septum, anterior intermuscular septum and the posterior intermuscular septum. Then below what happens is the deep fascia thickens to form the flexor retinaculum. Okay, the lower part of the leg it blends or thickens to form the flexor retinaculum, and above it is actually continuous with the popliteal fascia. So that is the disposition of the deep fascia, its attachments. So above with the popliteal fascia, below the flexor retinaculum, and then it is attached medially to the anterior and medial border of the tibia and laterally to the anterior and posterior margins of the lower triangular area of fibula. It gives intermuscular septum, anterior and posterior intermuscular septum. Not only that, it is also going to give deep transverse septum, which we will see. So here you are able to see the attachments of the fascia cruris, how it is attached to the anterior border of tibia, then to the medial border, and posteriorly you are able to see here it encloses the posterior compartment muscles, and the deep transverse fascia is again here. So coming to the as such the posterior compartment or the flexor compartment. So this is our posterior or the flexor compartment of the leg. In front you have the tibia and fibula and the interosseus membrane. So that forms the anterior limit of this compartment. Okay. So the interosseus membrane stretching between the interosseus border of the tibia and the fibula. Behind what you have is the fascia cruris or the deep fascia of the leg. Then you have one more deep transverse fascia which you are able to see here. This is the deep transverse fascia, divides the flexor compartment into the superficial group and the deep group. Okay, so that is the superficial group and the deep group. So above this is actually attached to the soleal line, the deep transverse fascia, and then it merges with the popliteal fascia above that. Below it blends with the flexor and peroneal retinacula. Okay, so with the flexor retinaculum and the peroneal retinaculum it blends with the retinacula of the foot, mainly the peroneal and the flexor retinacula, but not the extensor retinaculum. So one thing you have to remember, the posterior compartment, there is again a deep transverse fascia which divides the compartment muscles into a superficial group and the deep group. But certain authors claim that, or they describe, they are actually not present in two groups, but instead they are present in three groups: superficial group, then intermediate group, and followed by deep group of muscles. Okay, so that is the view of the flexor retinacula and the peroneal retinaculum. So you are able to see the peroneal retinaculum, which you are able to see here. Okay, so that is the peroneal retinaculum, through which the deep fascia or the fascia cruris as well as the deep transverse fascia will merge here, and on the other side you will have the flexor retinaculum. So the contents basically is divided into superficial and deep group of muscles. Superficially you have the GASTROCNEMIUS, Plantaris and Soleus, three muscles. Deep group you see here four muscles: Tibialis, Posterior, Flexor, digitorum, longus, Flexor, hallucis, longus and Popliteus muscle. Okay, so Popliteus, Tibialis, Posterior, Flexor, digitorum, longus, Flexor, hallucis, longus, four muscles. Then you have the posterior tibial vessels and the tibial nerve. Posterior tibial vessels and the tibial nerve. Now how, as I told you, in some books or some authors claim that three strata, the muscles are present. Superficial strata, we have seen in the previous slide, that is the GASTROCNEMIUS, Soleus along with the Plantaris. Intermediate strata comprises of the Flexor, digitorum, longus, hallucis, longus. Okay. The deeper strata is the deepermost muscle which you see here is the Tibialis posterior, present in a more deeper plane. So that, and the Popliteus. The Popliteus and the Tibialis posterior both are actually present in a same plane. Okay. So we will see the muscles one by one. The first muscle which we are going to see is the GASTROCNEMIUS muscle. It has two heads, medial head and the lateral head. Both arises from the respective condyles of the femur. Okay. So from the upper part and medial condyle of femur and popliteal surface of the femur, it arises the medial head of GASTROCNEMIUS. The lateral head arises from the lateral aspect of the femur, and also below that lateral condyle you have the groove for the Popliteus. From that also it arises. Okay. There is a bursa between the medial head and the capsule of the knee joint. So origin of the medial head and the knee joint, there is a bursa. Now from both the heads you see both the bellies, they are very bulk, and mainly these two bellies forms the bulk of your calf region. Okay. So the sural means calf. So main bulk of the calf muscles is by the GASTROCNEMIUS. Gaster means belly. So these two heads unite to form a broad aponeurosis, which will join with the soleus and form a tendon which is called as the Tendocalcaneus. The Tendocalcaneus, what happens is, gets inserted into the middle one-third of the posterior surface of the calcaneum. Middle one-third of the posterior surface of calcaneum. The other name for the Tendocalcaneus is the Achilles tendon. Okay. So that is about the GASTROCNEMIUS muscle, which arises by two heads, insertion via the Tendocalcaneus into the middle one-third of the posterior surface of calcaneum. Nerve supply is by tibial nerve. The next very slender muscle you see here is the Plantaris muscle. Okay. Present between the GASTROCNEMIUS, which is removed so that you will get a better view of the Plantaris. The GASTROCNEMIUS muscle has been cut. Both the heads of the GASTROCNEMIUS has been cut. Now you are able to see the Plantaris muscle and the Soleus muscle. Plantaris again arises from the lateral supracondylar ridge of the femur. Small fusiform belly. Synonymous muscle, equivalent muscle in the upper limb is the palmaris longus. It has a very slender tendon which you are able to see here. Passes downwards and blends with the medial margin of the Tendocalcaneus. Just blends with the medial margin of the Tendocalcaneus. Okay. Now if you look at the Plantaris tendon, it is inserted via the Tendocalcaneus, but lower animals it crosses and it is continuous with the plantar aponeurosis on the sole of the foot. Okay, it is continuous with the plantar aponeurosis on the sole of the foot. So that is about the plantaris, which is a vestigial muscle. The nerve supply is again by the tibial nerve. The next muscle which we are going to see here is the soleus muscle. It is actually shaped like the sole of the foot. That is why it is actually called as the soleus muscle. It's a multipinnate muscle. It has got a horseshoe shaped origin. So from the shaft of the fibula and from the soleal line of the tibia, and then you have an extension between these two, tendinous arch. Okay, so from the soleal line of tibia and also from the posterior surface of the shaft of the fibula and a tendinous arch extending, all these put together will give a horseshoe shaped origin. The fibers are actually present in the form of anterior lamellae and the posterior lamellae. Through the posterior lamellae, they become continuous with the tendocalcaneus, thereby blending with the tendon of gastrocnemius, and via the tendocalcaneus they will get inserted into the middle 1/3 of the posterior surface of the calcaneum. Okay, posterior surface, middle 1/3 of the calcaneum. That is the insertion of the soleus muscle. So in the upper part, it receives a branch from the tibial nerve on the deeper aspect, and in the lower part what happens is again it is supplied by the tibial nerve. So the tibial nerve supplies the soleus muscle twice. The soleus muscle has some other important functions. It is also called as the peripheral heart. Okay. Now why actually it is called as the peripheral heart is because it is perforated by many veins which are actually called as the perforators. These perforator connect the superficial with the deep veins, and what happens is they are actually provided with valves. The valves prevent the backward flow of the blood. Okay, so it is pierced by numerous perforating veins which connect the deep veins and the superficial veins. There are also some venous plexus which is surrounding the soleus muscle. Plexus of veins which is surrounding the soleus muscle, they are valveless. Those, okay, apart from the perforators, there are some plexus, and as I told you, they are pierced by the perforating veins. They regulate blood flow from the superficial to the deep veins, as I told you, the perforating veins, guarded by valves. So contraction of these soleus muscles squeezes the venous blood towards the heart, aids in venous return, pumping of the venous blood against the gravity. So aids in venous return against the gravity. So that is why it is also considered as the peripheral heart. So coming to the tendocalcaneus, which we are able to see here, it is a very long tendon, 15 centimeters long. It is also called as the Achilles tendon. So you all would have heard about that story regarding the Achilles tendon. So Achilles is actually a Greek king based on the Greek mythology. What happens is the life of this Achilles King Achilles, his life actually rests on this tendon because he was immersed in the river by his mother. So while immersing him upside down, what happens is her mother caught her by the region of this tendon near the calf region. So that part alone was not actually immersed in the water. The remaining whole body was immersed, so he became immortal. So if you try to kill him in any part, naturally what happens is he cannot be killed, but only if the Achilles tendon is cut, then naturally he will die. Okay, so There is also a very famous English movie you could have watched, Helen of Troy. Very old movie as well as latest version is also there. So something like even in we come across in Hindu mythology, where the Ravana king in Ramayana, Umbilicus, are able to understand. So only he will be killed if he is actually injured in the umbilicus. Same way Duryodhana in Mahabharata, only he will be killed only if he is injured in the medial side of the thigh. Okay. So my humble opinion regarding all these things, I believe, is because it is mythological characters. Not only that, might be these type of stories prevail to actually stress the importance of these structures. Umbilicus is again a very, very important structure. We think it is just a scar. Only in fetal life it is used to transmit nutrients or blood supply from the mother. But apart from that, so we will be discussing in some other time about the umbilicus. Same way, the importance of the Tendocalcaneus also, because when we see the function, then you will know why it is very, very important. So strongest tendon 50 centimeters long, so formed by union of the gastrocnemius and soleus. So that is why it is called as Triceps Surae. Sura means calf. So it is a triceps of the calf. Two heads of the gastrocnemius and the soleus. These three unite to form the triceps, and it is called as the Triceps Surae. So it is the chief plantar flexion at the ankle joint. Okay. So it plantar flexes your foot. So why actually the plantar flexion is very important? Because during walking, taking off from the ground, the heel has to be raised during your walking. So to overcome the inertia of the body weight, then naturally what happens is the action of this muscle is inevitable. So chief action is the plantar flexion, which is very, very necessary for walking or running. So Triceps Surae, combination of the gastrocnemius and the soleus muscle, raising the heel from the ground, especially during walking as well as if you want to jump. That is the function. So gastrocnemius muscle, mainly composed of white muscle fibers, it increases the range of the contraction. Okay. So fast contraction, rapid contraction is mainly for this gastrocnemius, whereas soleus multipinnate and mainly composed of red muscle fibers, slow and sustained contraction. And it also increases the power. Where one increases the range, the other increases the power, and soleus is responsible for slow and sustained contraction, so that it doesn't get fatigued easily. The muscle does not undergo fatigueness easily. So as I told you, it helps to overcome the inertia of the body weight. So when you want to propel, start your walking, so naturally you have to overcome the inertia. So because of this, the Triceps Surae and the action of this muscle is very, very necessary for walking as well as jumping. So apart from the plantar flexion of the ankle joint, they also aid in plantar flexion of the knee joint. So I will just play a short video. Might be there is some technical glitch when I actually pasted this video here, it is not playing properly. So here we are able to see here the gastrocnemius and the soleus muscle, both have united to form the Tendocalcaneus. Okay, it is getting inserted into the calcaneal bone. So plantar flexion of the foot is taking place. Plantar flexion of the foot is actually taking place. by the action of the tendocalcaneus muscle. Okay. Next, we are finished with the superficial group of muscles, the gastrocnemius, soleus and the plantaris. Now, the popliteus muscle. So, the action of popliteus we have already discussed extensively in the knee joint. You all know that it is actually the unlocking muscle of the knee joint. Now, we will see the origin and insertion. Tendinous origin. Okay. So, it has got a tendinous origin from actually the lateral surface of the lateral condyle of the femur. It arises by a tendon, lateral surface of lateral condyle of femur, passes between your fibular collateral ligament and the menisci and capsule of the knee joint. So, it is actually a intracapsular extrasynovial. There is an opening in the capsule. This part is intracapsular. There is an opening in the capsule for the popliteus tendon muscle. Triangular area, the posterior surface of the tibia above the soleal line. So, here you see the soleal line where the soleus muscle originates. Above the soleal line, posterior surface. Some of the muscle fibers also get inserted into the lateral meniscus. Okay. Few fibers to the lateral meniscus, and it is actually called as the articular muscle. So, here you are able to see the tendon of popliteus, insertion above the soleal line of the tibia, and few fibers getting inserted into the lateral meniscus, and these muscle fibers are actually called as the articular muscle. So, branch from the tibial nerve actually from the lower border winds around the lower border and supplies the deeper or anterior surface of the muscle. So, main action, as I told you, initiates flexion by unlocking. So, now from the extended knee, when you have to unlock, what happens is lateral rotation of the femur. So, it will pull the lateral condyle, unlocking. So, when an unlocking, what happens is when the knee is flexing, the lateral meniscus should not get caught between the two articular surfaces. It pulls the lateral meniscus backwards, and for this only it also gets inserted as articularis muscle into the lateral meniscus. Okay. So, initiation flexion by the lateral rotation of femur prevents the lateral meniscus from being trapped during flexion by pulling backwards. The next group of muscles, flexor digitorum longus. The flexor digitorum longus muscle arises from the fibula, posterior surface of fibula and tibia also. Okay. Flexor digitorum longus. Tendon passes deep to the flexor retinaculum and it is crossing the flexor hallucis longus tendon. Before it splits into 4 slips for the lateral 4 toes, it receives the insertion of the flexor accessorius muscle. It receives the insertion of the flexor accessorius muscle. Okay. And then it splits into 4 digital tendons for the lateral 4 toes, which is going to get inserted into the distal phalanx or the terminal phalanx. We call it as plantar surface of the distal phalanx or the proximal phalanx. Then these tendons will again be pierced by the tendons of the flexor digitorum brevis. Okay. It will also be pierced by the tendons of flexor digitorum brevis. Action: plantar flexion of lateral 4 toes and also maintains the longitudinal arch of the foot. Okay. So, prior to its insertion, it will receive the flexor accessorius. So, that is going to alter the line of pull of this muscle. The next muscle which we are going to see is the flexor hallucis longus. Flexor hallucis longus is again a very bulky muscle posterior surface of fibula, it somehow also covers the tibialis posterior muscle, overlaps the tibialis posterior muscle. Thereby, it also takes origin from the intermuscular septum and interosseus membrane. So, very bulky muscle. Then it passes deep to the flexor retinaculum on the under surface of the sustentaculum tali. Okay, below the talus you have the sustentaculum tali. It is inserted into the base of the distal phalanx of the great toe. Okay, so base of the distal phalanx on the plantar surface of the great toe, it is getting inserted. It also sends slips to the second and third toe tendons of the flexor digitorum longus. Actually, it is called as the Turner's slip. Okay, so the Turner's slip is actually two slips from the flexor hallucis longus to the flexor digitorum longus tendon of the second and the third toe. So, plantar flexion of great toe and maintains again the medial longitudinal arch and increases the force of takeoff point of the foot. So, that is about the flexor digitorum longus and flexor hallucis longus. Both are actually plantar flexion of the toes. The deepest muscle, more deeper plane, is the tibialis posterior. So, flexor compartment, deepest muscle, as I told you, covered by the transverse fascia. So, I told you there is a deep transverse fascia dividing the flexor group of muscles into superficial and deep group. So, that is actually present immediately on top of this tibialis posterior muscle. So, from the posterior surface of tibia, fibula and the adjoining interosseous membrane, between the two heads or between the two origins of the tibial and fibular origin, the anterior tibial vessel will pass through a gap in the interosseous membrane and enter the extensor compartment. It goes to the anterior compartment of the leg, that is the anterior tibial vessels. They enter the anterior compartment between the gap between the tibial and fibular origins of the tibialis posterior. So, the tendon, you are able to see here, it is getting inserted into the navicular bone. 2/3 of the tendon gets inserted into the navicular bone. Then it splits to get inserted into the all the tarsal and the metatarsal bones. Tarsal and metatarsal bones except the talus. So, except the talus, it gets inserted into all the metatarsal bones, and occasionally it might also accept to the fifth toe sometimes. Okay, tibialis posterior. The action is inverter of foot, mainly inversion and adduction of foot, and also plantar flexion, responsible for maintaining the medial longitudinal arch. So, inversion and adduction of foot, plantar flexion, as well as maintaining the medial longitudinal arch is the action of tibialis posterior muscle. Coming to the vessels and nerves, posterior tibial artery, large terminal branch of the popliteal artery. So, largest terminal branch, popliteal artery, divides into anterior tibial, is actually passing through a gap in the interosseous membrane and between the origins of the tibialis posterior muscle. This posterior tibial artery, one of the terminal branch of the popliteal artery, from the lower border of the popliteus enters the posterior compartment between the soleus muscle and the flexor muscles, flexor digitorum longus and flexor hallucis longus. Then deep to the flexor retinaculum, it divides into medial and lateral plantar artery. It divides into medial and lateral plantar artery. The anterior relation, it lies on top of the tibialis posterior muscle, then lower part of the tibia and ankle joint. Okay. Then posteriorly it is covered by the gastrocnemius, and in the lower part it is somewhat superficial and related directly or covered only by skin and fascia just above the flexor retinaculum. It is somewhat superficial, not covered because gastrocnemius muscle forms a long tendon. Laterally you see the tibial nerve, but the tibial nerve, what happens in the lower part again crosses from lateral to medial side by crossing superficially in the lower part. So laterally you have the tibial nerve, posteriorly gastrocnemius, anteriorly you have the tibialis posterior. The main branches is circumflex fibular branch, which is going to take part in the genicular anastomosis with the lateral genicular branches, circumflex fibular artery, peroneal artery, one of the very long branch you are able to see here, the peroneal artery or fibular artery, posterior tibial artery, one of the largest branch, and that continues as the lateral calcaneal artery, continuing as the lateral calcaneal artery. This peroneal artery gives muscular branches, nutrient artery to the fibula, perforating branch and lateral calcaneal branch. Perforating branch will again take part in the malleolar network, lateral malleolar network, anastomosis around the lateral malleolus, and even the lateral calcaneal branch, they take part in the malleolar network. So one of the largest branch is the peroneal artery. The intern branches of the peroneal artery are the muscular branches surrounding muscles. It supplies nutrient artery to fibula, perforating artery and lateral calcaneal branches which take part in the lateral malleolar network, whereas the first branch circumflex fibula take part in the genicular anastomosis. The other branches of posterior tibial artery are the nutrient artery to the tibia. Okay, here you are able to see the perforating branch of the peroneal artery. So this is your posterior tibial artery. Nutrient artery to tibia, muscular branches, communicating branch to the peroneal artery, communicating branch to the peroneal artery. Then you have malleolar branches, posterior medial malleolar branch, you are able to see your malleolar branch and calcaneal branch. And finally, medial and lateral plantar artery, which is going to supply the sole of the foot. So posterior tibial artery branches, circumflex fibular, peroneal artery, muscular branches, nutrient artery to the tibia, communicating branch to peroneal artery, medial malleolar branch, are also called as posterior medial malleolar branch, calcaneal branch, and finally terminal branches are the medial and lateral plantar arteries. Tibial nerve, you are able to see here, enters the posterior compartment again on the tendinous origin of the soleus, deep to soleus it passes. Tibial nerve and the posterior tibial vessels enter the posterior compartment of leg by passing deep to the soleus. Deep to the flexor retinaculum, again it is going to divide into medial and lateral plantar nerves. So posterior tibial artery divides into medial and lateral plantar artery. Tibial nerve divides into medial and lateral plantar nerves. It is actually lies medial to the upper part but crosses superficial and lateral to the vessels in the lower part. Divides into medial and lateral plantar artery at a lower level than the arterial division. Branches of this tibial nerve, mainly muscular branches, we have seen mostly all the muscles of the posterior compartment of the leg is supplied by the tibial nerve. Articular branches to the ankle joint. Then medial calcaneal branch, which is going to supply the skin over the heel, calcaneum, posterior part of the calcaneum. It is actually a cutaneous branch. Finally, applied anatomy, Achilles tendon reflex. So with the help of a hammer, we call it as a knee hammer, mainly to test the deep tendon reflex. It is a stretch reflex and monosynaptic reflex. So, which means where an afferent neuron and a efferent neuron is involved, there is no interneurons. Monosynaptic reflex. It is not a polysynaptic reflex. So, first you dorsiflex the foot, then you stroke the Achilles tendon with the help of the knee hammer. Then the patient should elicit plantar flexion. Immediately the patient will plantar flex the foot, or at the ankle region he will plantar flex. Then naturally what happens is the reflex is normal, which tests the integrity of the nerve supply of these muscles. Mainly the root value is S1 and S2. So if you want to test whether the spinal segments of S1 and S2, S1 and S2 segment of the spinal cord is normal, then it is mainly through one of these tests, which is the Achilles tendon reflex. So mainly to test the spinal segment, then to test whether the muscle is actually functional, gastrocnemius, and also to test whether the cutaneous innervation is intact. So rupture of Achilles tendon mainly due to sudden and forceful contraction. The tendon might get torn, then naturally you get a snapping sound and sharp pain. You won't be able to raise the heel, so it is not possible to walk. Only after surgical repair of the tendon, naturally the function is restored. Okay, Achilles tendon rupture. So with this I have completed the posterior compartment or the flexor compartment of the leg. Thank you very much for your patient listening.